All right, we're back. Why your dental visits could be making you sicker.
Designed to help you heal. It is designed to control symptoms, and that's
Not true. For example, if someone has a dental infection, would you argue that taking out that infection is just treating the symptoms? I mean, I think that's actually healing because you're getting rid of the source of the infection. Whether you're taking the tooth out or doing a root canal, you're eventually gonna let that person heal.
That's about it. Fluoride doesn't address the root cause of cavities. Mercury filling,
No one said it does.
toxins, and
That's not true.
they often leave behind infections that dentists can't see on regular x-rays.
That's also not true. So far, she told one thing that doesn't really mean anything. Fluoride does not address the root cause of cavities. Yes, that's true. The root cause is bacteria in your mouth that eat carbohydrates and they start pooping out acids that will actually make a hole in your tooth. But what fluoride does do is if it is in contact with that tooth, it actually strengthens it. So that critical pH is now lower. In other words, you need a stronger or more volume of acid to cause a hole or a cavity to form in a tooth that had fluoride versus a tooth that did not have fluoride. And then she said mercury fillings, which are those fillings that we got plenty of years ago. Some people still do them now, but those actually leak toxins. Now that is not true. If someone's telling you to get rid of all your silver fillings, they're actually gonna be doing more harm than good, unless you actually need to get them out, because you actually are exposed to a lot more of those toxins when you actually drill out those fillings. And there's studies showing that even when people have like 20 of these large silver fillings, that they barely get any exposure to mercury from those. Now I get it, you probably don't want to be exposed to any mercury. Well, we're exposed to way more mercury from things like our food, our water, and our air. And also the mercury that you would be exposed to from a silver filling is elemental mercury. This is not the toxic type of mercury that we find in fish. That is methyl mercury. But obviously she conveniently left all of that out. Now the last thing she addressed was the root canals leave behind infections. Well, there's a reason that root canals have a long-term success rate between 90 to 95%. They're about as successful as a knee replacement. And the thing is, if a root canal does fail, there's always a chance anything could fail, then you could just get the tooth taken out. And by the way, yes, we can tell with regular x-rays, and she's probably talking about like taking a 3D x-ray like a CBCT, which exposes people to a lot more radiation than a regular x-ray, which I don't know if she's aware of that. And it's not really something you routinely need to take on every single case if there's no symptoms and you're not finding anything on your regular x-rays.
Real healing starts.
This is where the real healing starts.
Remineralize.
You just have to buy her supplements.
Understand the connection between your mouth and your whole body. This is holistic dentistry, and it's what every patient deserves.
That's holistic dentistry for you, where you don't do traditional dentistry and you just pay her for all her supplements. Look, whatever you choose to do, that's up to you. I'm just here to give my 2 cents.